Otitis media, also known as middle ear infection, is a significant health and development issue among the Aboriginal and Torres Strait Islander children. This problem often develops within 3 months of birth and continues throughout childhood, causing not only ongoing hearing impairment but also affecting vital early childhood speech development, poorer educational achievement, and contributes to behavioral problems affecting social, emotional, and learning development. Without proper treatment and care and long-term damage, it can end up in permanent hearing loss. This presentation aims to discuss how and why the otitis media affect the Aboriginal and Torres Strait Islander children, its complications, and how it's been addressed by the government and the other organizations to resolve the issue. Otitis media is the inflammation of the middle ear. It often begins with a cold, sore throat, or other breathing problems caused by bacteria or virus. The infection spreads through the throat to the middle ear, to which it is connected by the eustachian tube. It causes swelling and fluid buildup in the middle ear, which puts pressure on the eardrum with or without a pain. Some symptoms to observe are high fever, unusual irritability, loss of balance, drainage of fluid from ear, trouble sleeping and hearing. As a result of their developing immune system, children are more likely to suffer from otitis media than adults. However, prevalence and severity are high among the Aboriginal and Torres Strait Islander children. Otitis media is the major contributing factor to the hearing loss among the Aboriginal and Torres Strait Islander children. The high prevalence of the ear disease among them has been identified since the 1970s. There are many factors contributing to otitis media among the Aboriginal and Torres Strait Islander children. The risk factors include socio-economic factors such as poverty, overcrowded or poor housing, malnourishment, lack of breastfeeding, limited access to services, and the environmental factors such as seasons, genetic factors, and exposure to tobacco smoke. Based on the 2015 self-reported data of the Australian Bureau of Statistics, more than 8.4% of the Aboriginal and Torres Strait Islander children aged 0 to 14 had long-term ear and hearing problems. That was 3 times higher than the non-Indigenous children at 2.9%. In Queensland's remote communities, 58% of Aboriginal children in the same age group had poor ear health, and in remote Northern Territory, this ranges from 8% to 50%. Furthermore, a staggering 93% of the Aboriginal and Torres Strait Islander children aged 0 to 4 years suffered from the middle ear infections, while the other 7% of that age group had healthy ears. There are many ways that otitis media and associated hearing problems affect the health and learning development of the Aboriginal children. Apart from the effects on children's physical health from the ear disease-related ill health, it also directly affects older children's learning development and schooling due to hearing impairment or loss. It can diminish the child's ability to talk and engage in classroom conversations. Consequently, it affects their school attendance and social and emotional well-being, which can progress to drug and alcohol issues, relationship breakdown, and criminal career later in the life. Furthermore, a child with hearing loss is 4 times likely to be sexually abused. The government has implemented various strategies to reduce the prevalence of ear disease and hearing loss over the past 15 years. As a result, the proportion of Aboriginal children with poor ear health and hearing loss has fallen over that time. Such intervention strategies driving this reduction include vaccines, evidence-based clinical guidelines, antibiotic treatments, neonatal screenings, surveillance, routine child health checks, and ear health education for families, which provide the support for better management for ear diseases. Apart from that, Northern Territory Remote Aboriginal Investment Hearing Health Program provides extended ear and hearing services to Aboriginal children who are at high risk in remote areas. This program includes health promotion and prevention, audiology services, clinical nurse services, and ENT teleology services, which also help to improve the ear health of the community. Although it is highly preventable, otitis media is a major health problem in the Aboriginal and Torres Strait Islander communities. It is important to maintain an organized support system to improve ear health in the Aboriginal children. Especially, the government should increase the resources to improve primary healthcare services with proper detection, implement ear disease treatment and management strategies, provide adequate housing facilities, improve education and employment opportunities in the community. These strategies are highly achievable by collaborating with the Aboriginal community controlled health services and clinical care to reduce the prevalence of otitis media among the Aboriginal children so they can communicate for their success they deserve.